As the world marks Universal Health Coverage Week, health experts in Nigeria say the country is still far from achieving the goal of ensuring access to quality healthcare for all without financial hardship. Habeebat Ajayi completes the report.
Although Nigeria has adopted universal health coverage as a national priority, millions of citizens continue to face barriers in accessing basic health services, particularly in rural and underserved communities. High out-of-pocket payments remain common, pushing many households into poverty whenever illness strikes. Despite these setbacks, the country has developed a framework to deliver UHC through a primary healthcare lead system, supported by general hospital and tertiary facilities for specialized care. Experts attribute Nigeria's slow progress to systemic challenges such as poor health financing, inadequate infrastructure, and a shortage of skilled media personnel.
We know that healthcare is very expensive globally, and and universal health coverage is like a solution. It's a solution to ensure that people, irrespective of your socioeconomic status, you're able to access care, and even in emergency situations too. So if a form of sensitization and orientation is also done in all those areas, and it's going to help, and also the various organizations and parastatals that are brought on board, the stakeholders too, everybody coming on board to ensure that it works, and proper enlightenment and also education of people about what it involves, because people have a lot of what I would call shallow or limited knowledge about health insurance and what it's supposed to do.
The truth is, if you go to most of the hospitals, you find out that a lot of people are passing through a lot of difficulties trying to finance their health challenges. A lot of people cannot even afford to be in the hospital because they don't even have. But this thing is supposed to be free for people, but it's not even going. People are not even finding it easy. So you find out that most people that are living well, in fact, some people, based on distance, some people are even traveling out to have their health stuff doing outside the country, because they find out that things that are supposed to be doing here, they are not doing it. So if things are working here, I don't think some people will be traveling out to be taking the medical stuff.
I don't think the healthcare coverage is meeting the needs of Nigerians, because looking at the budget as a whole, what is the provision for healthcare? If you ask me, I don't think that is adequate enough. Where are the infrastructures? You run to the hospital in the middle of the night, you are told stories, police report, that report. I mean, even when people's life is at stake. No.
I cannot say much about it, because how Nigeria is moving, everybody knows. But we thank God for life.
Stakeholders marking this year's UHC week say Nigerians must move beyond policy declarations and focus on building a functional, equitable, and sustainable health system that truly serves all citizens. Habeebat Ajayi, Trust TV News, Abuja.